Well, we've been watching the virus ever since it actually started, even in China, and as it entered into our country on the West Coast, and watching it slowly migrate itself across to Virginia. And once it did make a presence in Virginia, obviously we've been paying even closer attention to it. We actually was preemptive and requested a meeting with local VDH office or Virginia Department of Health office, and met with them prior to the governor even declaring an emergency. To start opening those chains of communication and have plans in place should this thing make an appearance in our community and as it grows to affect our community.
What are some of the things that this has changed operation-wise here in the department?
Well, here in Department of Public Safety, we're an essential operation that provides services 24/7. And we're kind of used to the fact of being able to work in adverse conditions, regardless of what the conditions may be. And so we've continued that philosophy. We have tried to keep our staff educated and up to the latest information as it comes out from CDC and the Virginia Department of Health, keeping everybody informed as much as we possibly could. One of the biggest things that we've been trying to instill is to not panic. We've dealt with diseases. We've always been dealing with diseases that can be transmitted from one person to another. In our line of work being healthcare professionals, we see that on a daily basis. And I've really been trying to emphasize to our staff and to the public when we've met with the public is we just got to not panic. Use what the CDC is telling us as far as good hygiene, washing your hands on a regular basis, using disinfectants in areas that are frequently come into contact with other places, keeping a safe distance away from people. They came up with the 6-foot rule, and that should be something we should always be practicing. We just need to be aware of that there is a disease that can be transmitted to us, and I'm not saying COVID-19 is the same as the flu. I know it's not the same as the flu, and that is a myth or rumor that really needs to be corrected. COVID-19 is not the flu. However, the way you protect yourself from COVID-19 is the same as you would protect yourself from the flu. We've all been told from early childhood age to wash your hands. If you sneeze, cover your mouth. If you cough, cover your mouth. If there's someone in your house that's sick, they stay home. If you're sick, stay home. Don't go and take a chance on getting someone else sick. And we've been taught that all of our life for just about any type of disease that can be transmitted to another person. And COVID-19 is no different. We should be practicing those things that we've been constantly been taught. And there's not a reason to panic, that we do need to use good hygiene, good cleanliness, and keeping distances and stuff. Now, what there is a fear of the COVID-19 is that there's no treatment. And that is unknown because it is new. There has not been treatment that's been developed for it. Yes, there's a lot of studies being done and a lot of treatments that's being tested to see what type of success they have been, which is the case anytime there is a new sickness or illness that comes about. I will go back to using something as simple as a heart attack. If you will go back 20 or 30 years ago and look at the treatments that was in place for someone with heart disease versus what is there now, we have learned a lot and we have adjusted. COVID-19 is new. We've got to learn it and we've got to adjust. But meanwhile, the way we protect ourselves is just like you would if someone in your house had the flu. And again, COVID-19 is not the flu, but the way you protect yourself from it is the same as protecting yourself from someone with the flu.
And we've seen a combined effort from the city and the county. Well, there's now a website that people can go, adding on to what you said, facts and not panic.
Right.
So we know that there's
that was something that we identified very quickly, that we wanted to instill that message of look at the facts, get factual information. I mean, we have been seeing posts on social media and different things, and people been claiming that there was positive cases of COVID-19 in Henry County now for weeks. But it's just not true until today. Today we've announced the first positive case in Henry County. But we beg people to go to that website. You can go to either Henry County's website or City of Martinsville. At the top of both of our pages is a quick link, and we try really hard to update that multiple times a day, in fact. And I would encourage people to just, if there's any question whatsoever, take a look at that site. And there's nothing on that site that's not going to be factual information. And if it's not on that site, then there's a really good chance that it's merely a rumor or a myth.
And some of the measures that, some of the public safety personnel are taking in conjunction with the center, the 911 center is asking some questions before you guys respond to an incident. And what are some other measures that you guys are taking, like cleaning the ambulances more, or?
Yeah, we're obviously taking those measures. When someone calls for 911, the dispatcher is asking some of those questions, and that's really to help the responders to prepare themselves to protect themselves. One of our greatest fears is if our responders start getting sick. And we have a limited, and that's not only with our responders, but healthcare in general. If our healthcare workers start getting sick and we start losing healthcare workers, or they start having to be quarantined because of this disease and so forth, then your demand of services continue to increase and your supply continues to decrease of what's available. So we're trying really hard to protect our responders. And then we have taken steps. So, I mean, we try really hard to disinfect our ambulances and equipment after every call anyway. But with this circumstances, just like we would with the flu season, we take some extra steps of disinfecting, following CDC's guidelines of how to keep our equipment in the cleanest possible atmosphere we can.
And for those individuals that are watching and still have some of that fear, what would you say to them to ensure that you guys are on top of this and are trying to make sure that, again, public safety is top priority?
Well, we have taken, and like I said, we've trained our providers, have kept them abreast, and new information is coming out every day. And we're constantly pushing information out to our providers as far as the latest that is available on the disease. But however, even with COVID-19, we still have patients having heart attacks. We still have people being involved in car wrecks. We still have the everyday emergencies that we're still responding to. So we're staying abreast of everything that's going on. There is a really good chance that when a provider shows up, they may already be wearing a mask of some sort. And that's not a fear for the patient, it's for our protection. And like I said, we've got to really do everything we can to keep our workforce able to provide the services. It would be even worse conditions if our workforce was actually to get depleted because they're all sick and at home. And when I'm saying workforce, I'm not only speaking about the career staff of Henry County Department of Public Safety. We have an amazing group of volunteers in our community with our rescue squads and with our fire departments, and they have all stepped up to the plate and have been coming together as one team, and we stay in constant communication with all of them as far as practices, best practices, and keeping everybody safe throughout this thing, because our volunteers are the backbone of our fire and EMS system, and they're really stepping up and doing all they can to protect themselves as well while continuing to be able to provide the services.
I don't know, you had a form there. Is there anything else you want to add?
I just got a couple of things here that I've made myself notes as reminders. We are staying in constant communication nearly on a daily basis with the Virginia Department of Health at the local office, with cell phones, even to the point phone calls and so forth over the weekends, nights and so forth, should the need arise. So we're staying abreast of what's going on in our community as that goes. And then the other thing I would ask is the emergency healthcare system, EMS and the hospital both, are being slammed because of this pandemic that's occurring. And as I mentioned earlier, we still have the daily emergencies that occur. And so our healthcare system is really being tasked. So we would encourage people to please follow CDC's recommendations. If you go to their website, they've got clear instructions on what to do if you feel that you're having the symptoms. And the first step is to isolate yourself, stay at home so that you don't take a chance on giving it to someone else, and call your doctor. Don't call 911. Don't go to the emergency room. Call your primary care physician. Make them aware of what's going on. And in a lot of cases, they may give you some instructions over the phone of how to treat yourself instead of even having to go to the doctor, period. So really, and now if you do have a life-threatening emergency, if your symptoms get to the point that it's life-threatening, by all means call 911. That's what we're here for. But if it's not a life-threatening emergency, you may be showing symptoms of COVID-19. That's okay. CDC has made it very clear. You stay home, you isolate yourself, you take good care of yourself. Again, it's not the same as the flu, but the way you take care of yourself is the same as the flu. Continue to hydrate yourself. Stay clean as possible. Don't get around other people.
And one thing just came into my mind. I know it's early stages and you may not have some information on it, but I'm pretty sure public safety is going to have a part in the new testing center that's being developed right now.
We are in the process. There has been a community effort to establish a central testing site. And the thing that we need to get across is that that's not going to be a test site that just opens up and anybody and everybody just show up to be tested, because that's not how it's designed for. The test cannot be administered without a doctor's order. It's just like a lot of healthcare tests. A doctor has to make that determination that the test is needed. So when the test site does open, then it's not just show up. You must go through your healthcare professional, through your doctor, and if your doctor determines that the test is needed, they will direct you to the test site and they will notify the test site that you're coming. So that is in the works. I think it's going to be a great thing for our community to help, and it's really to help remove some of that demand on our local doctors because they're getting bombarded as well. And that also exposes other patients to potential COVID-19. And if that's the only symptoms you're having, we're hoping we can set this site up to where it will be an open air, be an outdoor type setup, and you come in, you have your test result done, your test results will be sent back to your doctor. But again, that will only be after the doctor has advised you to do so and issued an order. People who show up without an order, there will be nothing that can be done for them at that site. A doctor's order will be required before a test can be administered.
And again, anything else you would like to add? Anything you want to let the public know?
The governor, as we all heard, has issued a stay-home order. I beg people to comply with that. I was just on a phone call of that someone was telling me that they are aware of people who just returned from New York and New Orleans, and these individuals are not practicing the safety thing, and the government, the governor, nobody wants to force people to stay inside. That's not the case here, but it is in the best interest for everybody for us all to isolate ourselves as much as we can. You and I, or the people listening to this, may be perfectly healthy, and even if we did get COVID-19, we may be healthy enough to survive it without any serious complications. An overwhelming majority of the people who have gotten COVID-19 have fully recovered without any long-term effects. But that may not be the case for the person that you pass going in and out of the grocery store, or it may not be the case for the senior citizen who you meet at Dollar General. Just they may hold the door open, or you may hold the door open for them, and you may be carrying the disease, and they may not be healthy enough to survive it. So please adhere to the recommendations and now the governor's order of staying at home unless it is absolutely essential for you to be out.